Hey people, it's Niall Stokey. I'd like to thank ProVac for free for telling me about this. So this is from AlJazeera.com. South Africa to start continent's first coronavirus vaccine pilot. African countries with the highest number of confirmed COVID-19 infections to begin trial of vaccine involving 2,000 people. Now, just before people hear this vaccine has not been tested. This is just to determine if it works. And like they said, like the French doctor said, they are testing it on black people. South Africa's plans to roll out the continent's first coronavirus vaccine trial this week, according to the universities leading the pilot, as the country grapples with the highest number of coronavirus cases in Africa. The vaccine candidate developed by Oxford Jenner Institute in the United Kingdom is already being evaluated there, where 4,000 participants have signed up for the trial. Why is it in South Africa? Why is it not in Italy or China? Isn't that where they had the most cases of all? In South Africa, the University of Witwatersrand, WITS, is collaborating with the University of Oxford and the Oxford Jenner Institute in the trial of the vaccine known as ChAdOx1 nCoV-19. The pilot will involve 2,000 people, including 50 who have HIV. I'll get to that in a bit. We began screening participants for the South African Oxford 1 COVID-19 vaccine trial last week, said the participants, and the first participants will be vaccinated this week. WITS vaccinology professor Shabir Mahdi told a virtual news conference Brazil is planning its own pilot, while the United States is preparing to test another vaccine in a mass trial of up to 30,000 participants. South Africa's coronavirus cases jumped up to more than 100,000 on Monday, while the number of related deaths approached 2,000. So, again, 98% survival rate? Why is a vaccine necessary for something so non-lethal? Officials implemented a strict nationwide lockdown on March 27, but in recent weeks, confinement measures are being gradually phased out to allow business to pick up and limit the damage to an already ailing economy. As we enter winter in South Africa and pressure increases on public hospitals, now more than ever we need a vaccine to prevent infection by COVID-19, Mahdi said, describing the vaccine trial as a landmark moment. Minister of Health Zweli Mkhize, echoing Mahdi's concerns, warning that South Africa was going through a devastating storm expected to peak during the cold winter months. At the opening of a field hospital in the Eastern Cape province, Mkhize said on Tuesday there were now more than 27,000 beds for COVID-19 patients and more than 400 quarantine sites across the country. Our scientific estimation is that 60 to 70% of our population may be affected by coronavirus, the minister said, and the hospitalization rates remain lower than anticipated. The new field hospital will be built in collaboration with the German development agency and car maker Volkswagen VW, the largest German investment in South Africa. A total of 3,300 beds were set up at a disused VW plant in the southern city of Port Elizabeth. Mkhize applauded the public-private collaboration as well as the healthcare workers battling the virus. More than 3,500 doctors and nurses in the country have contracted COVID-19, a highly infectious disease caused by the novel coronavirus since the start of the pandemic. And these 34 have succumbed to respiratory disease. So the doctors who work directly with the patients have even less chances of dying, because the above one had 100,000 cases and there were 2,000. So this is like 1 in 100 as opposed to the general population, which is 2 in 100. And it's actually quite disgusting that they're trialing this in South Africa, because there is a history of human experimentation in South Africa. If people who follow this channel, you know that I've talked about how they experimented, but actually not experimented, they attempted a genocide by deliberately infecting people with AIDS and HIV during the apartheid regime. And no, this is not a conspiracy theory for all those people. If you do try and come out saying that, I will block you. This is confirmed fact. There have been people involved in this apartheid regime who came out and admitted it on camera, and it's a well-known fact. It's just not talked about as much as it should be. And they're actually trying to test people with HIV. So what is the purpose? If people have a weakened immune system, it's extremely dangerous and could possibly kill them. But hey, they're not human, right? They're just guinea pigs whose only value is the scientific data we can collect from them. And it's no surprise that they're using Brazil as another study, because Brazil, no matter what they say officially, has a huge black population. So they want to see, can we exterminate them, and America, because America and Brazil both have the largest black populations outside of a majority black country. Anyway, yeah, this is all disgusting. Actually, and there's one thing I want to say. For a lot of people who want to say, like in America or in the diaspora, they want to say, well, what about going back to Africa? This is proof of what I always say. White supremacy is worldwide. These countries will just do what the white governments tell them to do. South Africa is officially independent, and yet they just go along with this, even though South Africa has the most reason to distrust everything that comes from them, and especially Volkswagen, a German company. Like, Germany has had some pretty, it's not real often talked about, but Germany has had some horrible history in Africa with what it's done in Namibia. Anyway, I don't want to keep going on about this, but anyway, please comment, rate, share, and subscribe. I'll leave this and some other articles in the description. If you'd like to support the channel, I'll leave my GoFundMe in the description. And if you'd like to follow me on Instagram, I'll leave that there as well. Peace.